Well, hello everyone. So our group today is going to be talking about specifically the Saginaw Public School District and our proposal on implementing a program that will help educate the youth within the school district about substance use and is more of like a prevention program. So going on to the next slide, our target entity justification. So the Saginaw Public School District it has a wide mix of urban and suburban students, and they all come from a very varying socioeconomic backgrounds. Um, and because it's such a diverse area, there's lots of different struggles that these youth may experience, depending on where they are located geographically. Um, and these different struggles also can correlate with different risk factors. There may be maybe some community disorganization. Poverty plays a huge role within these youth in the whole county and within the school district. And there is a lot of availability for different drugs and alcohol, especially. So these children do face increased risk factors for substance use, again, because of this high availability of it. So, what we noticed in our research is that there's a lack of protective factors. There's a lack of school programs and other community support systems that span way outside of just the school district, but also across the county. So, moving on to the classification systems. So, based on the Institute of Medicine, we are going to be at the stage of the universal prevention. So, on the scale here, you can see all the way on the left, um, towards the bottom of the prevention area, that stage, we're in that universal section. So what this does is we're trying to target all the students within the school district, regardless of their risk level. So even if they're at high or low risk, we want to make sure that there is some prevention plan in place for them, such as like a school-wide program. And we want to prevent substance use onset through the board education, and we want to make more awareness throughout the school district as a whole. And while we're doing this, we want to make sure we fit the school district's scope, make sure that we ensure inclusivity among all the students, no matter their backgrounds, while also aligning with the document's emphasis on early prevention for these young people.
Right. So during our assessment, we found that there were several risk factors in the area. Number one being the community. So, as Tyler said, there is a very large availability of alcohol and tobacco and nicotine products for these youth. There's also community disorganization due to economic decline within the last few years. And there's a lot of permissive norms around substance use, specifically alcohol. Alcohol is one of those substances that seems to be overwhelmingly normal to consume at pretty much any age. And one of the other risk factors that we understood is that it's the family. So potential family history of substance abuse, as well as high stress conflicts or dynamics within a family. It's also important to keep in mind the makeup of a family, whether or not that family is composed of LGBTQIA plus individuals, or what is seen to be the societal norm of the male and female parent family makeup. And it's also important to keep in mind the low income family management, or more so how the family conducts themselves when they are in a lower socioeconomic status. And then school and peer groups, if somebody is experiencing academic failure, they're struggling in school, they have a lack of commitment to school due to external pressures such as needing to work in order to cover some of the bills and things at home, taking care of younger siblings or aging family members, and then early initiation to due to gateway drugs. So a lot of times this will include alcohol, this will include tobacco and nicotine products, and even marijuana. Some of those opposite protective factors, however, are the individual themselves. So if there's a great deal of resilience among some of the students, as well as a positive social orientation from school involvement. So a lot of these kids may belong to after school activities or athletic clubs or teams. Next is bonding, so opportunities for attachment to teachers and staff, not just to peers. And then positive peer relationships, again, through school activities such as sports. And the final protective factor is healthy beliefs. So if we are reinforcing anti-drug attitudes consistently, it promotes this to become the school-wide norm and eventually to make it the norm for a general portion of society.
All right. For the planning and our logic model, first a little background information. I contacted the Saginaw School District and spoke to Leanne Bauer, Executive Director of Special Education and Student Support Services. Surprisingly, I learned that the Saginaw School District does not currently have any education or training targeted explicitly at substance use. She shared that the board has an approved tobacco use policy, which includes vaping, but there is no program educating students, staff, and faculty about the dangers and consequences of substance use. Leanne shared that when a student is caught or suspected of substance use, in addition to law enforcement, the school district works with health resource advocates to educate the student and family involved on an individual level. However, she recently learned that the federal funding for health resource advocates will end in June, so the school district will lose this key resource. Go on to our goal slide. A group outlined 3 goals supported by specific activities. First, increase student knowledge of substance use risks by 20% within 3 years. This will be done through delivering 10 annual workshops to educate 100% of students on short-term risks such as social consequences and health-related concerns, and achieve a 20% knowledge increase measured by pre and post test surveys. Second goal is improve refusal skills in 80% of students through interactive education within 3 years. Part of that would be training a goal of 500 students annually in refusal skills through peer-led role plays. And a third goal, strengthen school-wide protective factors by involving 50% of staff in campaign activities within 3 years through distributing a teacher integration guide to 50% of staff to reinforce prevention messaging and establish 50 teacher mentors to foster student bonding as outlined by Fisher and Harrison. We propose a hybrid curriculum combining the evidence-based life skills training program outlined by Fisher and Harrison with original supplements tailored to Saginaw's needs. This supports a universal approach and addresses the outcomes of increased knowledge, skills, and protective factors.
Okay, here are some of our ideas for implementation. Some of our strategies include education. We can implement evidence-based life skills by using a universal school-based curriculum targeting social and psychological factors of substance use. These could include interactive sessions on refusal skills, decision-making, and media influence awareness. We could also use information disseminations by including monthly assemblies with factual, non-judgmental presentations on short-term risks, avoiding the typical scare tactics. So we could also use community-based processes by partnering with school staff and local organizations to reinforce messaging. An example that we have here is the Saginaw Community Health Department. Stakeholders for this implementation would include school counselors. They would be delivering the life skills curriculum and monitoring the students' progress. The teachers would serve as mentors and foster bonding with the students. And the Saginaw County Health Department would provide data on local substance use trends and co-host assemblies. Oops. Here is some community outreach. Be Well is actually a part of Saginaw's Health Department. They will work locally to analyze and identify gaps in our county's mental health substance use system and increase access to our professional care for all. They create a variety of substance abuse related infographics that could be shared with the students. The organization also provides a mental healthopedia that provides students with resources related to substance abuse so they could reach out on their own. TAY is a Saginaw County organization focused on prevention and serves adults ages 14 to 21 in the Saginaw area. It's a bridge between childhood and adulthood that helps prevent undereducation, underemployment, unstable housing, substance use disorder, and criminal justice involvement, and they are also a part of Saginaw Community Mental Health Association.
And to evaluate all of our progress, according to our research, the best evaluation mechanism that we can use are pre and post surveys. So we plan to measure the knowledge of drug and alcohol use prior to and after the campaign, as well as attitude. So some of these questions may include what are the risks of alcohol use? And then we also are going to use a sort of skills assessment. So these are going to be role plays to test the refusal skills of students themselves after they have received the life skills curriculum. We're also going to look at and track behavioral data. So this is looking at any sort of suspensions or detentions or anything like that, any sort of consequence for substance-related incidents specifically. We are not looking at necessarily like any fights or anything like that. It is purely going to be substance related. And we'll do this by looking at school records and then comparing the yearly trends. We'll know that we have been successful in this campaign once we reach a 20% knowledge increase, again, using those pre and post surveys to measure 80% skill mastery and an overall 10% reduction in use of substance related incidents, such as suspensions, within 3 years.